Greetings to each and everyone. I'm Al-Faheed and this is Cluster 2, performing TSB, bed bath, and shampooing hair. So first is performing TSB. So, good evening po sir. Ako po si Al-Faheed. Kayo po ba si Sir Muiz?
Yes.
So sir, ngayon po ating simulan ang iyong tepid sponge bath para malasin po natin ang iyong temperature. Okay lang po ba sa inyo yun?
Yes.
Okay. So first is administering tepid sponge bath. So what we'll do first is to offer a bed blanket to cover the patient. And then assist in removing the clothes. Make sure you cover with bed blanket. And then roll off the top sheet. Okay. Afterwards, we place a waterproof sheet under the patient, or you can use waterproof pads. Then assist the patient in going up and place it underneath. Okay. So now you prepare the peg sponge water together with washcloths and towel. Then you wring washcloths and then place it in these areas. One in the forehead, in the underarms, and finally the groin. Okay. While that is happening, you can wring a wet towel, wring it, and then place it on the client's arm. While that is happening, on the other arm, you can start wringing the washcloth and sponge bathing the patient's arm. Do this for 3 to 4 minutes. Then dry with towel. Afterwards, you can repeat it on the other arm. Then after those, you can start proceeding to the other parts of the body. So we can go from there to the chest, and also the abdomen. And make sure after every sponge you should dry later with a dry towel. Then proceed to the abdomen. Then afterwards, you can proceed with the legs. Then you continue sponging and drying for 3 to 5 minutes in of all of those areas. Make sure that every 10 minutes you monitor the client's pulse rate as well as the client temperature. If the temperature is still above 37.7, you continue with the bath. If it is 37.7 and below, you can terminate the procedure. Then as for the pulse rate, if the patient pulse rate is still high, you can terminate the procedure and reassess after 5 minutes. Then after you have removed all of the wash clothes, the towels, and replace the patient gown, reassess once more for vital signs and uh, then reposition client in a more comfortable position. So you can remove the bath blanket and then raise the top sheet. Then place client in a comfortable position. And that is all for the bed sponge bath. Now, moving on to the bed bath. So just like in TSB, after you explain the procedure to the client, make sure that you have done hand washing and then done on your gloves. So prior to administering the bed bath, make sure that you have checked your client vital sign from temperature up to pulse. So first is that you should assist the client in removing the gown. Okay. Now make sure you have prepared two basins of warm water. One is for washing, the other is for rinsing, and make sure you have dry towels for you to dry the patient's body parts. So first, let's proceed to the face. So make sure to put Macintosh or bath towel under the patient's head and shoulder. Okay. So first, make a mitt using the uh, wet wet basin. Then dab it in the basin, and let's start from the eye. So the way you have to do this is from the inner to the outer portion of the eye, and use different corners of the mitt as you proceed for each body part. Then after the eye, you want to proceed through the face, the neck, and finally the ears. So after drying, we now proceed through the upper extremities, starting from the arms. So you have to uh, replace the Macintosh and put it on the forearm first. So uncover the forearm and then put in the Macintosh and the bath towel. Then proceed with washing it with soapy water. So from here, you start from the wrist towards the elbows, and then from the elbows towards the axillary. And then the axillary, and lastly, the hands. Then you rinse it with the other basin of water that has no soap. Then finally, you dry the arm. Then you do that same procedure with the forearm. Then after the both arms, we now proceed to the chest and abdomen. So assist the patient in lifting his back in order for you to put the Macintosh on his back. Once the Macintosh is in place, using a bath towel, you can put it on the upper trunk of the patient. Then we proceed on to the chest and abdomen. So same process, soapy water, wash, then rinse, then dry. As for the drying part, you can use the bath towel already in place in order to dry the upper chest. Then you can proceed to the abdomen. And then, of course, dry again with the same towel. After that, you can remove this towel. Then assist the patient in removing the Macintosh from below. So before proceeding to the lower extremities, make sure that you have changed your warm water in order to keep it just warm water, because at this point it would have pulled off. Then after replacing it, pull up the top sheet or blanket and then proceed to the lower extremities. So in here, we should start with the far side, but first let's cover the near side with towel. Then for the far side, make sure that you have put your Macintosh and blanket underneath. Okay. Then same procedure as for the upper extremities. Start with washing with soapy water. Okay. For this one, you should start from the knee joint up to the from the foot joint up until the knee, then from the knee up until the hips. Then remove the Macintosh. and then do the same with the other leg, covering the far side leg with towel once more. After that, let us proceed to the back and the buttocks. So for this, assist patient in the sideline position. So first, takilid. That. So afterwards, place the blanket, the towel and Macintosh underneath the patient's back. Okay. Then same process. You should wash with soapy water, then rinse with clear water, then dry with normal towel. So start from the back, then rinse, and then of course dry. Then you proceed to the buttocks. So you can cover this with towel on the upper portion before proceeding to the buttocks. Then rinse, and then finally dry. After it is completely dry, you can remove the Macintosh and then place client in a supine position. Okay. Then after this, you can start regowning the patient and to ensure comfort, rearranging the bed. And even after that, you can reassess for the client temperature in case something happened with the bed bath. And after you have secured the patient's vital signs and comfort during after the bed bath, you can document your recordings, and that's all for bed bath. Now, let's proceed with shampooing the hair. So just like in TSB and bed bath, make sure that you have explained the procedure to the client, gathered all the necessary materials for accessibility, and then hand wash and don your gloves. So prior to doing the actual shampooing of the hair, make sure to assess the client's scalp and hair before you do the shampoo. Then, once you make sure that there are no abnormalities within the scalp, we can start by first applying a uh, waterproof gauze sheet just below the client's uh, neck and shoulders. Okay. Yeah. Then, after that, make sure to have a calipad right below. Okay. And make sure that the calipad would drain down to the container below the client's head. Then, using a towel, put it below the client's neck and shoulder. Now, since the client is having top sheet, has top sheet on, just fan fold it, and then just apply a bed blanket. Okay. Then for the covering, we have two kinds. Add a towel to the client's eye, then cover the ears using cottons, so the water could not go to its ear. Okay. Now we can start by rinsing the hair. So make sure the water is warm, and then start rinsing the hair. Now that the hair is thoroughly rinsed, washed, we can now start applying shampoo. So, ditas mo lamang, lather it up, and then apply it to the hair. Start by massaging the scalp all the way to the back of the head. After the shampoo is thoroughly applied, you can rinse it again. Then, if the patient asks, you can also apply conditioner after you rinse it. Wait for a few minutes, then rinse it once more. Afterwards, using a different towel, you can start drying the patient's hair. Okay. After you have made sure that the hair of the patient is sufficiently dry, you can start now removing the face towel, the cotton, and then lifting the patient's head up and removing the damp towel and the calipad. Okay. Okay. Afterwards, you can also remove the waterproof bed. At this point, you can start combing the patient's hair, or if the patient is able, he or she can do it himself. Then, for patient comfort, you can always put on pillow. Now, since we're done with that, we can now remove the bath blanket and then fold the top sheet or blanket up. And after you have secured and contained all of the materials used, you can reposition patient or re-level the bed for patient comfort. And after discarding all of your equipments, that is it for shampooing the hair.